everyone for joining us today. My name is Lori Marie Peixoto, and I'm the Director of Strategic Partnerships and Education at Needymeds. Let's begin our webinar. The objective of today's webinar is to provide you an overview of all of the different types of patient assistance resources we have on our website, which is www.needymeds.org. Who is Needymeds? We are a national nonprofit organization. Here's our homepage. We were founded in 1997 by a retired physician, Dr. Richard Sagel, and he remains our current president and director till today. And he did this undertaking with his friend, who was a medical social worker at the time. In the mid-90s, they discovered patient assistance programs through the pharmaceutical companies, and they thought every patient and every physician should know about them. So since it was the mid-90s and the internet was becoming a major source of information, they decided to create a website. So Dr. Sagel taught himself computer programming and designed a website. So we are considered an informational resource. Through our website and toll-free helpline, we connect patients to programs all over the country that will help them pay for healthcare expenses, including but not limited to medications. We do not offer financial assistance to patients, but we refer them to programs that do. About 1.3 million people use our website every year, and that includes patients and their family members, healthcare professionals, social workers, patient advocates, and community healthcare workers. There are 4 different categories of patient assistance resources that you can find on our Needymeds website. And all of these resources are found on the Patient Savings tab, which I'll demonstrate to you in just a moment. The first are prescription assistance programs, as I just mentioned. The second are diagnosis-based assistance programs, and these are for expenses other than medicines, like wigs for chemotherapy patients and durable medical equipment. These are probably the 2 greatest sources of savings you'll find for your clients, the PAPs and the DBAs. This is where you want to start your search when you're helping a client. We also have a section of coupons and rebates, and then we have some other resources like government programs, discounted imaging services, medical bill mediation, and so on. And lastly,
Lori, can we interrupt for a second?
Sure.
Are you going through the slides because we're just seeing the first slide on the PowerPoint? It's not going anywhere. I mean,
oh goodness. Do you see it now?
Yeah.
Yep. Okay. Okay. Well, do you want me to start over so you have the? So you have it in the recorded, or should I just keep going?
Just keep going.
Okay. So as I said, the first 2 places you want to look when you're trying to help a patient or a client are the PAPs and the DBAs. You'll find the most savings in those 2 sections. Then we have coupons and rebates, and then we have some other resources that I'll briefly show you. And then the Needymeds drug discount card, which is what we would consider the last-ditch effort to find some savings for a patient who may not qualify for the other types of patient assistance programs. So our website began with just a handful of PAPs, but now we have about 7,000 programs ranging from all of these different types of resources. All of the information on our website is available at no cost. You do not have to register. You do not have to set up a username or password. You can just explore the website completely anonymously. So let's begin with an overview of prescription assistance programs, and I'll demonstrate them to you on the website as well. These are programs that are sponsored by pharmaceutical manufacturers, and there's no law that requires a pharmaceutical company to offer discounted medicines to people that are low income or that do not have health insurance. And so since there's no law requiring a pharmaceutical company to offer these programs, not every medication will have a PAP. And those that do have PAPs will have their own eligibility requirements and their own unique application process. So each pharmaceutical company can do its own thing. They'll provide free or deeply discounted medicines to people that qualify. And so eligibility requirements usually include information about the patient's income level, their insurance status, and their diagnosis. As I mentioned, each program is unique, but the one common element in all of these PAPs is that the prescriber always needs to be involved in the application. They need to provide a valid prescription and they need to sign the application. So where might one find more information about PAPs? Well, that's where Needymeds comes in. So let me show you on our website where you'll find PAPs. Does everyone see our website? Do you see our website? Okay. Hello? No? Yes? Okay. So no, you still don't see the website.
Oh.
Okay. Let me, I'm sorry about that.
We just see the go. There, we see it now.
Okay. So let me just zoom in a little bit. Here's the Needymeds homepage. There are two ways to find a prescription assistance program. The first is to type the name of the drug in the drug search box. And the second way is to go to the Patient Savings tab. And as I said, this is where you'll find all of the prescription assistance programs, all of the diagnosis-based assistance programs, and coupons, rebates, government programs, and additional resources. Patient Savings tab is the most important part of our website. So here, let's say you wanted to search for a brand name drug like Abilify. You can scroll down and you'll see that we have Abilify in an oral solution or a tablet. Here's an example of a PAP. Sometimes a drug will have more than one PAP program, and if that's the case, the programs that provide the greatest assistance are at the top of the list, and programs that provide lesser assistance are at the bottom. In this case, we have one program right now. It's sponsored by Bristol-Myers Squibb Patient Assistance Foundation. If you or your client have any questions about this particular application, please direct them to Bristol-Myers Squibb Patient Assistance Foundation as opposed to Needymeds. Here's a link to the website. This link right here will take you to an active PDF of the application itself, so you can print it out and get it ready for signature. This will tell you the medications that are covered in this PAP. The eligibility requirements are the most important section of a PAP application. In this case, Bristol-Myers Squibb Patient Assistance Foundation is trying to help people who have no prescription coverage. Those with Part D are considered on a case-by-case basis, and they're looking to help people with an income level at or below 260% of the FPL. FPL is federal poverty level. And so you're thinking, what does that mean in practical terms? If you click on this button, it'll pull up an FPL calculator. So if I had a family of, that had an annual income of $50,000 a year, and I calculate that, I can see I'm at 269% of the current federal poverty level. So that's slightly over by 19 points of what they're looking to help. But let's say your family or your patient is just a little bit over the federal poverty level. Let's say they're at 255%. If you find yourself in that situation, I would recommend calling Bristol-Myers Squibb Patient Assistance Foundation and asking them to make an economic hardship exception for your patient. because there's some subjectivity involved in the application process for the PAPs, and they can make exceptions on a case-by-case basis if you're just slightly over the income requirements or the FPL requirements. As I mentioned before also, not every medication will have a PAP. So if you or your patient needs a medication and there's no PAP for it, it's still worth picking up the phone and calling the manufacturer of the medication and asking them to offer you a reduced price for the medicine, ask them to make an exception, economic hardship exception, explain your patient's story to them. We were told from pharmacy insiders that they really don't like to say no to people, and they try to say yes whenever they can. And unfortunately, because of the gaps in health insurance in our country right now, patients really have to learn to be assertive advocates for themselves. And so it may feel a little awkward to ask a pharmaceutical company to make an exception for you, but they do it all the time, and it doesn't hurt to ask. The worst they can say is no. Also, if you apply to a PAP and your patient is denied, appeal. We've been told by pharmacy insiders also that if they say no to a PAP application, they will often say yes to the appeal. The appeal is sometimes, you'll find information about the appeal process on the website. It's usually filling out a form or writing a short letter explaining your situation to the pharmaceutical company. And again, you may think that it's a lot of effort and it feels uncomfortable to kind of be pushy, but it pays off in the end. And if you or your patient can get deeply reduced or even free medication just by being a little bit assertive, it's worth it. And if you need any guidance on that, feel free to call us at Needymeds. We can offer some tips on how to talk to the pharmaceutical companies. The application section will give you information about how to submit the application and the turnaround time. In this case, they say that they usually make a decision within a week. But I would say always estimate that it'll take between 2 to 4 weeks from the time you apply to the time you actually receive the medication for your patients. Better to overestimate than underestimate and then have your patient have a gap in their medications. The medication section will tell you where the medication is sent. Sometimes it's sent to the patient's home, but other times it goes to a doctor's office or their clinic. So you want to pay attention to this section as well. You'll also want to note in your client's or patient's chart how often they have to reapply to this program. And in this case, they need to apply once a year. So you'll want to make a note of that in your patient's chart as well. So that's a PAP for a brand name drug. You can also look for a generic name drug. Program name is, for example, Bristol Myers Squibb Patient Assistance Foundation. So if you already know the name of that program, you can simply look on that list. Company name is a pharmaceutical manufacturer who makes the drug, so you can search for your medications that way. And if you know the name of the application that you need because you use the same ones over and over, you can look in the program application section. $4 generic discount drug programs is something rather new at Needymeds. This is a directory of all of the generic discounted programs all across the country. So for example, in the state of Minnesota, you have 18 drug discount programs. And they're organized by retailer. So you have Costco and CVS, you have Sam's Club, you have Target, Walgreens, and so on. Usually what you'll find in this section are generic medications for people that qualify, and they're reduced between $4 to $15, usually for a 30 or 90-day supply. And so this is a nice directory for people who perhaps don't have health insurance or drug coverage, or maybe they're in the Medicare Part D donut hole. These programs vary in terms of eligibility requirements, but it's worth checking out. We've also been told from an organization that did some research on this that Costco tends to have the cheapest cash prices for medications compared to other major retailers. So if you have a patient who's really in a jam and they really don't qualify for any program, and perhaps the Needymeds drug discount card doesn't offer any significant savings, it might be worth making a call to Costco to find out the cash price of a medicine. And you do not have to be a member of Costco to use their pharmacy. So some of these applications, as you can imagine, might be difficult for people who perhaps don't have internet access, or maybe there's a language barrier, or maybe they're just not internet savvy. So if you do not have time to help a patient apply to these programs, you can either refer them to Needymeds and we will help them, or refer them to the Prescription Assistance Application section here. This is a directory of nonprofits across the country that will help people apply to these programs, and they'll help them in person. So in the state of Minnesota, for example, you have 4 programs that will help people apply to PAPs. And they'll do this usually for free, or sometimes a small fee or a small donation. I'll just point out underneath that section, we have coupons, rebates, and more. If you know the name of the product you're looking for, you can search for it by the product name. But I also want to let you know that another handy tool is to search by a category. So if you have many patients that have diabetes, you can search under diabetes, and you'll see a listing of coupons for diabetic supplies. So we have testing strips and glucose monitors and so on. These links will take you to the manufacturer's website. Some of them will offer a free 30-day supply or a trial size. Some of these will require a prescription from a prescriber. Some of them are for mail-in rebates and so on. So you can take a look at this and see if this might help a patient who's struggling to pay for their diabetic supplies and so on. As I mentioned before, the second greatest source of savings will be a diagnosis-based assistance program, and that's here in the middle column. So you can search by a diagnosis, or you can search by the area of service, or if you already know the program name. So let's search for a diagnosis. Let's say I have a patient with breast cancer. So I searched under B for breast cancer. And here is a directory of 203 DBAs for breast cancer all over the country. These programs will provide financial assistance for things other than medications. So this could be wigs or transportation services, house cleaning services, testing, supplies, durable medical equipment, and so on. You'll also find some assistance for co-payments here. We've listed programs that provide national assistance at the top, and then underneath the national programs, we've listed them by state alphabetically. So as you can see scrolling down, let's see. We have a couple of programs that will help people, exclusively help people who live in Minnesota. But people who live in Minnesota are also free to apply to all the national programs, which are listed at the top. And that's breast cancer. That's a very specific cancer. You can also search for cancer in general. So I can look under C for cancer and pull up even more programs. And you can search for any diagnosis, whether it's diabetes or prostate cancer or visual impairment, and so on. Underneath the DBA section, we've also tried to make this as comprehensive as possible for people. So we thought it might be helpful if we also provided a directory for camps and retreats based on diagnosis. So if I wanted to see camps for people that have, let's say, childhood cancer. There are 88 camps for childhood cancer. And we've organized them and tell you where they accept campers from, as well as where the camp is based. Underneath camps and retreats, we have a directory of scholarships. So for example, if I wanted to see scholarships for children with ADHD or AIDS or multiple sclerosis and so on, you get the idea. So another resource we have at Needymeds is a directory of government programs. This is where you'll find programs that will help with all sorts of conditions. These are programs that are sponsored at the federal level, sometimes at the state level, and others are sponsored at the county or city level. This is where you'll find your PACE sites. PACE is Program of All-Inclusive Care for the Elderly. These are nonprofits. I think there are 23 of them in the country, or 23 states have PACE sites, and these help disabled and elderly people receive all the care they need in their homes so they don't have to live in a nursing home. So all of the PACE sites will be listed by state. This is also where you'll find free programs for low-income people. You'll find, for example, a program that will help low-income or uninsured women get breast and cervical cancer screenings. You'll find them organized by state, but we've also cross-posted them with the DBA section. So if you're looking for help for cervical cancer or breast cancer, you'll find that program in both places. So you won't miss it if you look in one place versus the other. Let's see. Also, in the government programs, we've listed all the SHIP sites. SHIP sites are federally funded health advisory programs that provide health insurance counseling to Medicare recipients. So your state's SHIP sites will be located here as well. We've recently added all of the government-sponsored assistive technology programs for people who have disabilities. They are entitled to have assistive technology funds. We also have a guideline for the federal poverty guidelines if you wanted to learn more information about that. And we also have a tax return request form here just for your convenience. Underneath that, we have a couple of additional resources I'll point out to you very quickly. HealFunder is a crowdfunding platform. It's similar to crowdfunding platforms like Kickstarter or Indiegogo, except that HealFunder is exclusively for medical expenses. It could be expenses that have already been incurred. For example, if the patient had an uninsured stay in the emergency room or hospital and they have a huge bill, they could raise money for that. Or it could be something that a patient is saving up for, like orthodontia or something like that. It could be for cosmetic procedures as well. What's different about HealFunder is that we verify the diagnosis, and we also verify that the funds raised go directly to pay the medical bills that we say they're supposed to pay. And we do this to try to eliminate the chances of fraud. Underneath HealFunder, we have partnered with a company that will offer discounted imaging services. So there are 2,500 imaging providers across the country that participate, and they'll offer a discount off the cash price of an MRI or CAT scan. If you're interested in applying for this or you have a patient who needs an imaging service, they can call this 800 number and ask for an application and ask for more information about it. We've also partnered with a company that offers medical bill mediation. So if you have a patient who has thousands of dollars, at least $1,000 or more in unpaid medical bills, they may qualify for this program. The average discount is between 30 and 50% off the total bill. I know that this company that runs this mediation program charges $200 for the service, and that's a lot of money. But if you have a patient that has thousands of dollars in unpaid medical bills, this may be worth it to them. They can call Needymeds and get more information about this program at our 1-800 number right here. And lastly, I just want to touch on the Needymeds drug discount card. And so let me just take us back to our PowerPoint. Do we have any questions before I move on? No?
Nope, I guess not.
Okay. So this is the Needymeds drug discount card. It's a free card that can save consumers between 0 and 80% off the cash price of a prescription med, an over-the-counter medicine or supply if it's written as a prescription, like aspirin or glucose testing strips or the stem cap, cervical cap, or Ensure nutritional beverage, things like that. And it's also good for pet prescriptions if you're buying them at the People Pharmacy. And the card is only good at brick and mortar pharmacies. It doesn't work for online purchases. How does the card work? Well, it works the way all the other drug discount cards work. Basically, pharmaceutical manufacturers haggle over discounted prices with pharmacies with the help of an adjudicator. And in the case of the Needymeds drug discount card, the adjudicator that we are proud to work with is Argus. And we think Argus is fantastic because of all the drug discount cards on the market. They offer the greatest savings to the consumer. And so these discounts get renegotiated frequently, and they change probably day to day and week to week and month to month. And they'll vary from pharmacy to pharmacy. And they'll even vary from a CVS located in Minnesota to a CVS located in Florida. So each pharmacy chain has negotiated its own price. There's no activation or registration for our card. As soon as you get your drug discount card, you can start using it. The card never expires. There are no residency, income, or insurance guidelines, which means anyone can use the card. And currently, we've contracted with over 63,000 pharmacies across the country to take our card. And that's all the major chains like CVS, Rite Aid, Walgreens, and so on. And a lot of the smaller chains take it now too. Anyone can use the card, literally anyone. The only rule, however, is that it cannot be combined with health insurance. So if you have health insurance, whether it's private health insurance through your employer or whether it's Medicaid, Medicare, Veterans Administration benefits, you have to choose between using the drug discount card or your insurance. And you have the right to make that choice every time you make a purchase at the pharmacy. In fact, you can ask the pharmacist to tell you which will give you the greatest discount, the drug discount card or your copayment. Most often, copayment's probably the better deal, but occasionally, surprised to hear that our drug discount card will beat a copayment. So it's always worth asking. So if you have a patient who has Medicare Part D and they find themselves in the donut hole, the coverage gap, they can certainly use the card because it's just like paying cash. Basically, you're paying cash and getting a discount off the cash price. But keep in mind that when they use the drug discount card, it will not count toward getting them out of the donut hole. So they should think about if it's, if they're almost out of the donut hole and it makes sense to keep using their insurance, or if they're not even close to getting out of the donut hole and they don't expect to be out of the donut hole, then maybe it makes sense to pay cash and use the drug discount card. That's something that they would have to consider. So again, if you have a high copayment or deductible, feel free to try to use the drug discount card instead of your insurance. And I'll also point out that what's handy about the drug discount card is that, as I said, anyone can use the card. Your greatest savings will be the PAPs and the DBAs. But if you or your patients do not qualify for a PAP or a DBA, they should try to use the drug discount card because there are no eligibility requirements. And this is particularly important if you have a patient who is an undocumented immigrant, because using the drug discount card is just like using a coupon off the cash price. So if you have an undocumented immigrant who desperately needs a medication that they can't afford, you can give them a drug discount card, and hopefully that will help to some degree. But again, your greatest savings are the PAPs and the DBAs, and the drug discount card is sort of your last-ditch effort to save something. If you want your drug discount card from Needymeds, you can print out a paper copy off our website. And I can show that to you in just a moment where you'll print that out. The paper version is just as good as the plastic version. You can always send us a self-addressed stamped envelope, and we'll send you a drug discount card that's plastic, or you can go to the website and order them yourself. If you'd like to have a LinkAge line customized drug discount card with your name and logo on it, we're happy to print those up for you. And there's no charge if you print them in black or white. And you'll get your own unique tracking number. So that means you'll get a report every month on, number one, the number of transactions your drug discount card has been used for, and number two, the dollar amount of savings. You will not receive any confidential information about your users because we're not collecting that information either. We're not collecting people's names and addresses and matching them up to what we buy, which means we're not selling that information to third-party marketing companies. And so we don't have that information, and therefore you would not have access to that information. As I said, you'd have a monthly report with the dollar amount you're saving your patients and the number of times the card was used in that month. If you would be interested in having customized drug discount cards for LinkAge, you can email my coworker Deb at needymeds.org, and she'd be happy to help you design a card. And again, that's free. There's never a charge for that. We have some tools to make using your drug discount card easier, and I'll show them to you right now on the website. We have a drug pricing calculator, which will tell you an estimate of the price you would pay that day in a particular pharmacy. We also have a directory of all the pharmacies contracted to accept the card. We can design an app for smartphones customized with your organization's name and logo on them so people can download it from your website. We can also design a PDF version of a card that you can put on your website and people could download as they need to. And on the back of every card is a toll-free customer support number. One number goes to Needymeds and the other number goes to Argus, and you can call either of us if you have any difficulty using the card or any questions. So let me just show you on the website where you would find that. So if I go to patient savings and drug discount card, here's where you can print out a PDF version of the card. If you wanted us to mail you a plastic card, you can fill out this online form. And this is for individual orders. You can direct your patients here. They can choose between one of these 4 card designs. They can send us a self-addressed stamped envelope. Here's the pharmacy locator. So if you want to see all the places in Minnesota that take our card. Oh, sorry, I have to put in a zip code. What's your zip code in Minnesota?
56301.
56301. So there are 8 pharmacies in the 56301 area code that take the card, and all of the places in this list are contracted to accept the card. If you ever have any difficulty with a pharmacist who says, oh, I've never seen this card before, I don't think we take it. If they're in this list, they do, and you can call the customer support number on the back of the drug discount card, and either Needymeds or Argus can explain to the pharmacist that they are legally contracted to accept your card because they're in our directory. Here's the drug pricing calculator I mentioned. This is a very handy tool. So if I click here, this is going to take me to Argus's website. Argus, again, is the adjudicator that helps negotiate the discounts between the pharmacies and the pharmaceutical companies. So you can put in the name of a drug. Well, sorry about that. You can put in the name of a drug. You can search up to 5 pharmacies in your area. You would put in the quantity of the drug or the day's supply, and you would click on price. And over here on the right side, it would create a table with the location of the pharmacy and the estimated drug price. I say estimate because it could be a couple bucks more or less than this estimate. And the estimate is only good for that particular day because, as I said, the discounts change frequently. But this is a handy tool if you're explaining the drug discount card to a patient and you want to see what the drug discount card can do for their particular medications, you can look up with your patient or client to see what the discount would be. And the discounts change all the time, so if it's not discounted today, it may be discounted next month or in a few months, so check back frequently. And so we also have a discount card app for smartphones that can be downloaded right here to a smartphone. And I believe there's also a pharmacy finder function in the app. So if you are helping your patients and you would like more resources to help you in your service as advocates, we have a patient advocates newsletter, which is called PAN. It comes out generally once a month, and we try to include practical tips for advocates and even for the patients themselves who are trying to find savings and support. You can sign up for that under the Advocates tab on the home page. That's also where you'll find our Patient Assistance Program Update Service, or PAPIS. This is a free daily or weekly alert of all of the changes that have been made to PAPs on our website, so you can keep abreast of those changes. Because as I said, PAP programs change frequently. They open, they close, they change their eligibility requirements. If you want to be kept abreast of those changes, feel free to sign up for PAPIS. DAPIS is very similar to PAPIS, except that it's for the diagnosis-based assistance updates. So again, you'll learn when a program has opened, closed, when changes have been made to the program, and so on. These are free services you can sign up for. We also have a course called Patient Assistance Resource Education. This is a course that is targeted to healthcare professionals, patient advocates, social workers, people who help patients apply to these programs. It's very similar to the webinar I'm doing for you now, except that it's a self-paced online tutorial. Students who complete the tutorial and pass the exam receive a certificate of completion for their portfolio. We typically charge about $15 per student, but if you were interested in this and that was a hardship for your organization, we could reduce that fee. We also have something called PAP Tracker software. If you help a lot of patients apply to PAPs, PAP Tracker software will make that process a lot easier for you. It eliminates handwritten applications and the manual tracking of orders. So instead, for example, if you had a patient that needed 5 different medications, instead of filling out 5 different PAP applications by hand for that patient, you would simply put the patient's information into the software once, and then you would select all the PAPs you wanted them to apply for, and then it would automatically generate those applications for you, and then you could print them out and get them ready for signature. It will also help you keep track of the application status, the delivery of the medications, when it's time to order refills, when it's time to renew your application. You can store patients' documents in the software, and it also makes generating reports very easy. So if you have to tell your funders how much the dollar amount of savings you're saving your patients every month with PAPs, this is a very good tool for that. You can also generate reports on your demographics and so on. So PAP Tracker software is specialized for PAPs, and we have a grant program right now for nonprofits and if you qualify, I think you would receive a $2,500 grant for that. If you want more information, I'd be happy to connect you to the right person at Needymeds. We love to partner with like-minded organizations. So again, we're happy to customize a drug discount card for you with your name and logo on them. I'm happy to do as many webinar trainings as you like for your staff. If you have ever considered establishing a patient assistance program or funding a program, we could help you start that. We could help you manage that. We have experience with that. We'd be happy to cross-post each other as resources on the website. We'd be happy to have you submit articles for our newsletter, for social media, and so on, and we'd be delighted if you would consider letting Needymeds be listed as a resource on your website, or perhaps occasionally allowing us to be a guest in your social media posts or even your own newsletters. The Volunteer Project is a free service that we offer organizations. This is an instruction manual and technical guidance that will help you train volunteers to help people apply to PAPs using the Needymeds website. And it's totally free to any organization that wants to start a volunteer program to help people get connected to PAPs. If you're an individual and you want to help Needymeds in your free time, we have an ambassador program. Ambassadors will represent Needymeds in their community at health fairs and conferences, and maybe even give a little talk about Needymeds at their church or synagogue or mosque, or maybe their local library or clinic. If you want more information about being a volunteer for Needymeds, feel free to email me after this presentation. And so here's my contact information if you have any questions that come to mind after we part ways. If you want to order drug discount cards, Needymeds brochures, which come in various languages. We also have patient education booklets that you can give to patients that explain how to find prescription assistance programs and other patient assistance resources. If you or your patients need help navigating the website, finding a particular program, looking for help, please call our toll-free helpline. We're available Monday through Friday, 9 to 5. And with that, do we have any questions at this time?
Could you
any
send
questions?
me the PowerPoint that you
Sure,
went through
certainly.
today?
Absolutely.
And I'll send that out to everybody. Are there any other questions? Is there questions? No, there is no questions. Thank you very much.
You're very welcome. If anything comes to mind, feel free to email me. And I thank you for your interest in learning more about these resources. If there's anything we can do to help you help your patients, if there's any way we can be of service, please just call me and let me know. We're happy to work with you in any way that makes sense, and we're open to ideas too. So if you have any partnership ideas in mind, let us know.
Okay, thank you.
Thank you. Have a great day.